Anti-infective drugs are powerful bullets, but on the way to its target, a bullet sometimes causes unintended damage. Amphotericin B is the drug of choice for treating invasive fungal infections, mycosis, offering broad-spectrum coverage and low resistance. Unfortunately, amphotericin B also causes acute toxicity and significant nephrotoxicity. And these problems are not fully resolved even with lipid preparations of amphotericin B. An ideal anti-infective would therefore be one that automatically targets and selectively kills the cause of infection without damaging healthy tissue. It would hence have much less toxicity. Nobel Prize winner Paul Ehrlich framed this concept over a century ago and called it the magic bullet. Now the long wait for a safer formulation of amphotericin B is over. Cipla Research and Development has developed liposomal amphotericin B, the magic bullet for treating invasive mycosis, Phosome. In the late 1970s, scientists discovered an interesting property of phospholipids. That is, when they are hydrated, the hydrophobic tails mutually attract, while the hydrophilic heads seek the aqueous medium, thus forming a phospholipid bilayer around an aqueous core. The lipid bilayers then seal off to form a liposome. Since liposomes are composed of natural lipids which are biodegradable and biologically inert, their toxicity is minimal. The amphotericin B molecule is a good candidate for liposome-based drug delivery because it has a useful duality. On one side, it has a polyhydroxyl chain which is hydrophilic, and on the other side, it has a polyene hydrocarbon chain which is lipophilic, which allows the amphotericin B molecule to be encapsulated between the double lipid layers of a liposome. However, creating a true liposomal preparation is expensive and involves several complex processes. Cipla is only one of the few companies in the world which have successfully developed this advanced liposomal technology. The first of many complex steps is to intercalate amphotericin B between layers of bilipid film. When the layers of bilipid film are hydrated, they swell up, and when they are agitated, the layers close up to form large multicellular vesicles. The size of these vesicles is greatly reduced to nanosized particles using a technique called high-pressure homogenization. These are true SUVs, single unilamellar vesicles. Such liposomes can be infused intravenously without any additional process such as sonication. When Phosome is infused, the liposomes containing amphotericin B travel towards site of infection, for example the lungs and the spleen, which are the prominent sites to be affected. In the bloodstream, these are selectively taken up by the reticuloendothelial system. Macrophages engulf the liposomes through a process, endocytosis. As the liposomes degrade, they release amphotericin B at the site of infection. This controlled release is the reason why Cipla's Phosome has an efficacy similar to the parent compound but is much less toxic. Now you have the power without the problems. Now the long wait for a safer formulation of amphotericin B is over. Cipla Research and Development has developed liposomal amphotericin B, the magic bullet for treating invasive mycosis, Phosome.